I'm your leadoff hitter today, and we'll share a few thoughts, and then I'll pass the baton to the other speakers, and then we'll, as Leah said, we'll have the chance to talk amongst ourselves and share more perspectives on the connection between mental and physical health. But just by way of introduction, my name is Reena Pande. I am the Chief Medical Officer at a company called AbleTo, which seems like a perfectly apt name in this room of change makers. I am actually a cardiologist by background, and so you might scratch your head a little bit and wonder how a cardiologist got to focusing on mental health. And for me, it was having spent many years in academic medicine. I did all my training in Boston, which is where I still live. Came to the realization that, boy, we spend a lot of time trying to inspire and motivate our patients to make change. In cardiology, making changes to diet and nutrition and smoking habits is central. I mean, 70 or 80% of the risk of cardiovascular disease is related to these things we have the power to change. And yet, it's so hard for our patients to make those changes. And what I came to realize a little late, I'll admit, is the degree to which we don't really, as physicians, think about what barriers are keeping our patients from making those changes that we and they know are in their best self-interest and will impact their outcomes. And then it came a little later in the game, and my understanding, the recognition that for so many of my patients, mental health was that barrier. And that we did such a poor job, even at a Harvard teaching hospital, to be honest, at identifying that need and being able to direct our patients to high quality mental health care solutions. And it really was central and foundational and frankly a prerequisite. And I think if we don't do better at tackling that mental health comorbidity for our patients with physical health conditions, boy, are we losing an opportunity to really help them make the changes in behavior and other outcomes that we seek. So a couple of statistics, and you'll see in our three presentations, the numbers are pretty close, maybe not exactly the same, and they come from very similar sources, but the concepts are the same. We have a lot of patients suffering with mental health conditions. You can see in the top right, at least 1 in 4. Some studies would say even more than that. And in the top left, so many people are suffering and are not receiving the care that they need and deserve. So a lot of undiagnosed patients, and a lot of those are going untreated as a result. For me as a cardiologist, the bottom left was what brought me to this work, this realization that, oh my goodness, at least 1 in 4, maybe studies would say even more than that, of my patients with medical conditions, and I came to it from a cardiovascular perspective, but you could substitute diabetes, chronic pain, what have you, a rheumatologic condition like rheumatoid arthritis, you name it. And that statistic will be basically the same, that at least 1 in 4 of our patients with physical health ailments are also suffering from depression or anxiety, and a lot of the time that's going untreated. What was really interesting to dig into the data was to discover that when the two go together, a physical health condition and a mental health condition, the total cost of care is 2, 3, 4 times greater than if you had heart disease or diabetes or chronic pain without depression or anxiety. So a real opportunity to help patients get better. And as you see on the bottom right there, the main number here, the main point here is that number starts with a B, billions of dollars of cost to the healthcare system and lost productivity if you account for the impact to employers. So I started this work 2013 was when I kind of realized that there was more to be done and that we needed to think about integrating physical and mental health, that we needed to think about how to use technology to get better access to mental health services for our patients in need. So 2013 is not even on this figure. So when I started with AbleTo, the chatter about mental health in these circles was probably high, but out in the rest of the community was just barely a whisper. We would show up at a health plan to make the pitch that they should work with us, and it was like, we've got that, thank you. It's only 3 or 4% of our budget, so we're not really paying attention to that. And the message that we had to send was, hey, by not spending money on mental health, you're actually spending a whole lot of money on mental health. And that was the change in the conversation that we were trying to make, the educating we were trying to do. And what's been really neat is to watch that people, consumers, all of us are starting to really think about mental health. This is sort of a fun trick. You can go to Google Trends, type in whatever you want, and see the frequency of searches in Google for a particular topic or subject, and this is what we did. And so if you look for mental health services near me, you see this sharp increase. So people are thinking about this. That quote on the top right I thought was super interesting. Mental health related books outsell diet and exercise books for the first time at Barnes & Noble's in the LA Times last year. Interesting, really interesting. This is a focus. Just clipped a couple of headlines, whether it's the New York Times or, I should have had Forbes for you, Leah, but I don't have there is plenty of stuff in Forbes too, or LA Times. This is top of mind, which is great. Now the problem is that consumers, patients, we people are thinking about this, but access has not kept up. This is just a figure pulled from a paper published a couple of years ago. This is psychologists, it could be psychiatrists, it could be nurse practitioners. The figure looks the same. There's not enough access to care. I won't go through all the stats, but we have a problem, and it's a problem that we need to figure out how to solve. And so what has happened is that this has happened. So you guys may realize, and maybe hearing, and maybe even seeing commercials for all these technology-enabled and digital solutions to try to meet that need. An app for this, an app for that, a platform for this. And it is extremely confusing for folks like Carrie, who sits on the health plan side, a bombardment of these potential solutions. How do you start to tease out what's right for a patient? How do we direct patients to the right solutions that meet their clinical need, but at the same time, the right modality of engaging with them? My company is one little logo on this slide, AbleTo, in the telehealth bucket at the top right. We tackled this solution by providing virtual access to licensed mental health clinicians, enabled by a technology platform. And then also an app, so a more intense intervention and then a lighter intervention to help meet a patient where that patient is in terms of the severity of their condition and the modality by which they're most likely to engage. But the challenge that we've seen, it used to be that we would have been the only one on this slide 6 or 7 or 8 years ago. And now there's this explosion of solutions, all claiming to increase access. Many have clinical merit. But what we need to be thinking about next is not just access to solutions, but access to high quality solutions. And I think that's going to be the next thing that we in the mental health space and in integrating mental and physical health focus on, is how do we make sure the care that's being delivered is actually of high quality, that's clinically sound, and not just opens up access. And because if we can marry access to quality, that's when we can really see results. So in the last minute, let me just tell you a little bit about the work we've done and the successes we've seen in thinking about this integrated approach to mental health care and physical health care. So we have a national network of about 700 licensed professionals that are delivering our evidence-based programs via our technology platform or just by the plain old telephone, if that's the easiest way for you, a little more anonymously, to engage with our providers. And when they can do a cognitive behavioral therapy program in that fashion that's very quality assured, clinicians are all supervised, we're making sure they're actually adhering with fidelity to the clinical protocols. You can see the kind of outcomes that we're showing on this slide. Mental health symptoms get better, depression, anxiety, stress. And the real thesis was by tackling mental health, can we have an impact on physical health outcomes? And we've spent a lot of time focused on measurement-based care and proving that that thesis is actually true. That if you can tackle someone's depression, actually, they're going to be more likely to test their blood sugars. Fasting morning blood sugars will go down. Smoking cessation is improved. Adherence to medications is better. Pain scores are lessened. And the last real thing to cinch it all together is that top right, which is that if you can do that, you can make the pitch that there's a real financial argument to doing so. So patients get better, and that you can keep them out of the hospital and save money for our payer friends. It's a win-win for everybody. So for me as cardiologist coming to this work, it's been so fun to be an agent of change like all of you and to preach the message that we really have to think holistically about integrating physical health with mental health to really have the greatest impact that we can. So thank you.